Hi, I'm Elliot Fishman, and this is the December 2008 quiz. So this is a special quiz for a number of reasons. It's the 12th quiz for this year, and it's the last one. But also, these are the 10 cases from the RSNA film panel that I ran for RSNA at RSNA 2008. So the first question is, what's the best diagnosis in this case? You can see a very nice example of a cystic renal mass, and with multiple septations, and this differential diagnosis. You know, it's cystic. Could it be a cystic renal cell carcinoma? Definitely. Could it be a complex cyst? Definitely. Multilocular cyst? Definitely. But there's a new entity that's been described recently, cystic and solid and septated and thickened wall, a MEST, M-E-S-T tumor, mixed epithelial stromal tumor. And that's the answer. And Dr. Weinrib got this correctly on the film panel. Okay, next case. What's the best diagnosis, or in this case, what's the least likely diagnosis? Here was a patient who was paraplegic. There's a cystic lesion arising off the region of the right hip. You see some of the changes that relates to the patient's initial trauma and the fact that the patient's paralyzed. So possibilities. Could this be an abscess? Absolutely. And TB was a very good thought, and Dr. Palmer thought that, and that's a very good possibility. It's not a tumor. It doesn't look like an osteosarcoma. There's no matrix. This, in fact, was an amyloidoma. Very, very unusual, but a great diagnosis. Okay? Next case. Least likely diagnosis. And I showed this case to Eric Stern, who got it correct. This was a paraganglioma. Vascular lesion, right renal. Obviously not renal, right pulmonary hilum. Well, you could think about Castleman's disease, and you can think about paragangliomas. I guess a vascular metastasis, another possibility. There was a hint that the patient had a neck mass and had an adrenal resected, so this was multiple paragangliomas. The one thing is it's not TB. TB is typically cystic or low density, does not enhance, so that's the least likely diagnosis. Next case, what's the best diagnosis here? And I gave you a few examples, few possibilities, and this was a case Lori Lovner had. The case was given to me via Reading Hospital, and this was a great case. And you can see there's what looks like an infarct in the brain. There was an MR that went with it. This was actually a form of sarcoidosis, neurosarcoid, and Elaine Lewis gave me this case, and it's just a terrific case of sarcoid, and there was the lung findings as well, very nicely shown. Okay, next thing, what is the most likely diagnosis here? And this was a patent ductus arteriosus, and you can see it very nicely, very nicely. You know, surgical conduit, coronary artery fistula are all possibilities. But, you know, this was the classic. And in my most recent lecture or podcast, I discussed this case. Now, a next series of cases were this one. What's the least likely diagnosis? And I put lymphoma as the least likely diagnosis in this case because the mass is hypervascular. A young patient, I would have thought of Wilms, I would have thought of renal cell. This was a crazy case. This was a fibrous tumor of the kidney. It used to be called hemangiopericytomas. Very unusual, and the film panel got this wrong, and so did we. Next case, what about this one? Best diagnosis. Well, Jim Zinderite gave me this case, and you know, obviously you think about infection, you think about tumor. This is a unique entity, often helped diagnosed with MR of high signal intensity on T2. It was called sinonasal organized hematoma, and I grilled Lori Lovner on this one. It's an article in my favorite journal, the AJNR, in July 2008. So it's a specific entity. It's a benign entity, can be confused with malignancy. It's just a wonderful case. And then the next case, I gave this one to Eric Stern and Ella Cazzaruni. Prominent septal lines, you go through failure, you go through a number of different things. But then I also showed pleural thickening, which you can kind of see posteriorly. And this is a wonderful case via Dave Nadich and Philippe Grenier. This is a case of Erdheim-Chester disease. The key thing, of course, I didn't give you the diagnosis, but the prominent septal lines. But this was Erdheim-Chester disease, and I got those guys on this one as well. I then showed Mike Federle and Jeff Weinrib this case, told Mike it wasn't in his book. You can go through a lot of things. This is a young patient, so maybe it's a pancreatic tumor. Good possibility. Very unusual case, cystic with calcification. I read this case personally. I did not make the diagnosis. I thought more pancreas, or if it wasn't pancreas, a teratoma. This was a very unusual duodenal duplication cyst. What a terrific case. And the last case, I said the least likely diagnosis here, what you see is a sacral mass, destructive, location, location, location. You got to think chordoma, giant cell tumors, good. This was actually an extradural sacral myxopapillary ependymoma, very unusual case. The one thing it's not is an abscess. So with that, I've shown you the RSNA film panel. If you want to see it, go to rsna.org. You can see it live. You can see all the pain and suffering by the panelists and me having one great time. Go under the image interpretation session. I think it's worth your time. And with that, that's December, and we'll see you next year.